our older driver safety, Ms. Amanda Jackson with the Occupant Protection Group, and Ms. Emma Harrington, who leads the young adult driver testing. Give them a hand.
Good afternoon, everyone. We will also endeavor to keep you awake as you await the afternoon ice cream, because really that's why we're all still here at this hour. So I do run the Older Driver Task Force. I split my duties as Deputy Director for Injury Prevention at the Department of Public Health, and my time with a great funded GOHS grant to fund our Older Driver Safety Program and our Older Driver Task Force. The reality here is that just as everyone else wants to do, we want to reduce injuries and fatalities, and we want to really enhance the mobility options for our aging population. Who here is not aging? There's always one. I had several half-raised hands. So everybody's aging. Everybody needs to think about mobility. And as we all talk today, if you couldn't get around via your car, how would you get around? If I took everyone's keys today, SUVs first, please, I have a toddler. Then how would you get around tomorrow? Those are the questions you should ask yourselves and the types of plans that we endeavor to make with the Older Driver Task Force. We want to make the roadways safer for all users, and of course our framework, which should look very similar to you by now, is the 4 E's. And everything that we do with data. You've had a lot of data today. It's been really fantastic, very detailed. I am going to take a different approach to data. So buckle in. Pac-Man and I are going to get you through a couple of data slides, and then we're going to talk a little bit more about what it is that we do. Lila, thank you for laughing. All right, so we've seen this today. Older drivers are overrepresented in the fatality data. Now, why is that? Is that because they're horrible, terrible drivers? Or maybe it's for another reason. When we look closer at the data, we realize that actually older drivers tend to have fewer crashes. Any guesses as to why that is? So they do somewhat drive less. They are sometimes slower, although my granny would argue with you, Director Blackwood, about that slower bit. They don't drive it at odd hours. They're actually really good at self-regulating. So let me ask you this. If at 30 you are a terrible driver, and assuming that you actually make it to 80, what are you? Older to dangerous, downright dangerous in all seriousness, right? But if you're 30 years old and you're a good driver, assuming no huge physical or cognitive declines, what might you be at 80? 50 years experienced. Marriages don't last that long. It's a big achievement when they do. So it's important that we understand the level of experience that older drivers bring to the table. What are our older drivers typically cited for? Lots of the same things that the rest of us might have been cited for in the past. Following too closely, not yielding, weaving. A lot of these you might also contribute to folks that are distracted. And maybe they are distracted, maybe they can't see, maybe they're having other issues. So they're often pulled over and cited for the same items that other folks of other ages are. But this is important for our law enforcement to notice. Where are our older driver crashes happening? We've got some surges in Region 3 and Region 7. One of the things that we're doing with our partners is to focus some of our educational outreach into those areas specifically so that we can reach those older adults and chat with them and help them be safer on the road as much as possible. So now on to what I call the fun stuff. Our task team objectives, it's always to improve seatbelt use. We're partnering with some of our other occupant protection groups on improving seatbelt use. Older drivers tend to wear their seatbelts and are more likely to wear their seatbelts, which is fantastic. They also don't drive at night, so there's a little bit of a balance there. But we can always improve their seatbelt use. We want to assist them in staying mobile. Please keep in mind that mobile does not mean being behind the wheel of a car. It also does not mean snatching away the keys at age 65. It really is about their abilities. And we really want resources to be available to both professionals and to the communities as they're working with our aging population. So we've got a little bit of a tiered approach to how we approach older driver safety. First, can we help ourselves? We all like to help ourselves. We're a nation of independent folks. That's why we like our cars so much. So let's help ourselves. And we can do that through programs like Car Fit, where you assess your ergonomic fit in the car, or perhaps taking a defensive driver course. Who here likes a discount? Raise your hands, everybody raise your hands. If you don't, you should. Everyone in the room can take an online defensive driver course and get a 5 or 10% discount on your insurance. So those are really important things. Once folks begin to have issues, we want to address those skills. It could be something as, it's complex, but it's a simple thing to fix. Perhaps somebody's on a lot of new medications because they're managing a chronic condition. If you properly manage your medications, you might not be weaving all over the road. So prescription drug management is a big issue here. Once we are addressing skills, or maybe you're that terrible driver and there's no hope for you, but that's a different discussion. And then there is a point in time where we talk about driving cessation and alternative transportation options. It's a little bit of a fragmented system in Georgia. If you're in the metro Atlanta area, we've got great options with MARTA and MARTA Mobility. There's travel training available to folks, and they can ride for free while they're doing their travel training, which is a huge plus. But what do you do out in the rural areas where we see fewer people wearing seatbelts? Those are some of the target areas for our task force. At the end of the day, everything we do is related to partnership. I would like to think at some point in time, everyone in this room is connected with at least one other person that they did not know today in order to communicate and to partner. I've got fantastic, and they fund my grant, yay for a salary, but Governor's Office of Highway Safety, they talked to me about things that are going on with older drivers. I got to attend the Atlanta Auto Show this year and meet with some new partners that are going to help us work on older driver issues in the future. Other partners that are really important to consider for everybody in the room are area agencies on aging. So whenever someone refers to a AAA, it is not necessarily the auto club, though we love our auto club friends. They are the area agencies on aging. These are not just for older adults. This is for any adult with a disability, any adult in need of assistance. There are 12 in Georgia, because we are a large state. Every state in our country has some number of area agencies on aging, and I would encourage you to reach out to them in your work, no matter what population that you work with, in order to see what they can help you with. They can help you with data, they can help you with access to services for the population that you serve, they can help aging folks and folks with disabilities with transportation. So these are really fantastic resources. The other important thing here is to know your audience. Folks, I got a 5-year-old. This is as good as the jokes get, okay? It is really critical to know your audience. So I would ask you this in just a moment. First of all, we need to understand some things about our aging audience. What does it mean to drive? How are their skills? Can we observe those skills? And then making a plan and having conversations around those skill sets and mobility beyond driving. How old were you when you got your first set of keys to drive a car? Say it loud, I'm half deaf.
21.
16, I got 21s. I think my kid's gonna be 30 before he finally gets a license. So early to late teen years, right? This is a good average, maybe between 16 and 20 these days. You get your first license, your first set of keys. I would argue that actually we get our first set of keys as toddlers. And we get our first set of keys as toddlers as something to play with so that we can be like mommy and daddy and aunts and uncles and older brothers and sisters. Because that means we're growing up. That means we're going to be a big girl or a big boy. And hopefully your kid doesn't stick him in a light socket. I don't have experience with that or anything. And then one day you graduate and you get the actual set of keys. Now, I don't know what your keychain was. Mine was Batman and he was cool. But I bet you remember what one of your first keychains was. What did it mean when you got your first license? When you got that first set of real car keys? What does that mean? Freedom. Freedom, independence, responsibility. What other keys do we get in our lifetime, folks? Houses, other cars, lock boxes, vacation homes, maybe a boat. Happy when you buy it, happy when you sell it type of thing, right? But keys are intrinsic throughout our entire life. And then at some age, your children whom you raised and you took around to soccer practice and you did all kinds of things with say, Mom, you're too old to drive. I need your keys. And they strive to take your keys away from you. So the psychology behind what keys mean to us becomes very important when we go to approach an older adult, when we go to approach anyone who should no longer be safe on the road. I'm not suggesting that we not take away the keys where appropriate, but we are better able to reach this audience when we understand where it is that they're coming from. And that is one of the main goals of our task force, is to help them understand to help their families understand and to create those connections so that folks have a chance to be more mobile. Generally speaking, when I ask an audience of older adults what they would do if they could not drive tomorrow, I get some hell no, you're not taking my keys. I would rather die, and they're serious. And to some more lighthearted answers like, hey, you should have taken my spouse's keys 10 years ago, where were you, lady? So it's a varied number of responses, but all of them very serious and how they're understanding what it means to have this set of keys. So this is another important thing that we do as a task force. Another super critical partner of ours is the Department of Driver Services. We have worked as a task force with these folks to create an updated type of form for the medical revocation process. Among my officers in the room, has anyone ever used this form? Welcome to it, guys and gals. Thanks so much. All right, so in order for a driver's license to be taken away for a medical issue, if you see somebody weaving on the road, someone that seems out of character and that's not an obvious DUI, you can actually report that person for a medical revocation process. A driver review is what it's called. You can write a letter, or if you're an officer or a citizen, quite frankly, you can also fill out this form that initiates a paperwork process with our good friends at the Department of Driver Services. They send a letter out to the license holder. They let that person know that they need to visit their doctor, and their doctor needs to return some forms. Now, if the person does nothing, they get another letter after 30 or 60 days, 30 days? 30 days, looking at Danae, my expert. And they are then told they have another 30 days to comply or their license is suspended. So basically, if you do nothing, you lose your license. It is appealable, but we don't talk about that. If you go to your doctors range in what they do, and this is another thing that my task force works on. They range from taking your pulse and sending you on your way. I've had a call about that, to running you through a mill of tests and helping you make a determination on whether or not you can still drive. It varies. We've got a lot of work to do in this arena, and so that's where we need additional partners, is to help us with the medical community. Medical community is fantastic, but they are not necessarily trained on how to assess a person for their ability to drive as they age, so that's an important partnership for us. The last thing I will bug you with is my rah-rah about the YADTT program. Who here has heard of YADTT? I see more hands every year. This is good. All right, so YADTT in essence is a communication program. It is designed so that first responders can get additional information about a patient in the event of a medical emergency, generally a car crash. The yellow sticker, which you see on the far side of the screen, goes in the rear driver's side window of the car. That alerts our first responders that there is a medical vinyl packet in there with emergency contact information, medical history, medications, a picture of the driver, and anything else they would want you to know. All of that goes in the glove box of the vehicle. In other states across the country, YADTT has existed or exists in some form or fashion in 30 other states across our country. No one else evaluated the program, so we took it upon ourselves to do a small pilot in Athens and Dublin. We liked what we learned from the process and how to set it up, and so I'm very pleased that with funding from Governor's Office of Highway Safety, we are able to roll this out into communities. Communities can earn up to 1,500 packets by doing some things for me. So if you help me get it set up in your community, when you take ownership, when you launch the program, and really important, when you train your first responders to use and report on the program, and we can talk more about that offline. Those are the types of things that are going to earn you packets. This is a huge push because I'm sitting on 40,000 packets and I'd really like them out by next year. So if anyone is interested in helping me with that, I would really appreciate people joining the Older Driver Task Force. We do meet the third Wednesday of every month from 10 a.m. to 12 p.m. We do have a conference call option, so if you are not close to Clifton Road, that's not a problem. We can accommodate that. And maybe we can even move our meeting to your location once, because we do like to encircle new partners in new ways, so we are often moving to other locations. I thank you for your time. If you have any questions, feel free to give me a call.
Good afternoon, everyone. My name is Amanda Jackson, and I'm the Occupant Protection Task Team Leader under Tracy Reese's support and leadership. So we're going to talk about some data today. So in 2015, motor vehicle crashes were the 13th leading cause of death in the United States, but ranked 7th for overall years of potential life lost. And for individuals 8 to 24 years of age, it was the #1 killer. And in 2016, more than 1,600 Georgians were killed from motor vehicle crashes. And this data is from Georgia OASIS, which means it tracks all motor vehicle crash fatalities. And in 2016, as Denise mentioned earlier, 48% of occupants who were killed in car crashes were unrestrained, and the national seatbelt rate is 90.1%, which seems pretty high, but that means every day, 27.5 million Americans are not buckled up on our highways. And in 2016, seatbelts saved over 14,000 lives in the United States. So this data shows that seatbelts do work when they're worn correctly. And in 2016, unfortunately, 63 children were killed in motor vehicle crashes in Georgia. To give the age breakdown of this, 5 were under the age of 1, 8 were from 1 to 3 years of age, 15 were from 4 to 7 years of age, 20 from 8 to 12, and 15 from 13 to 14. We can see as that children got older, their deaths increased. And NHTSA reported in 2016 that the United States motor vehicle crash fatality rate averaged 2.02 per 100,000 individuals. In Georgia, it was 3.03 per 100,000 individuals. So yes, we are higher than the national average, but we did not rank in the top 5 states. And research has always shown how car seats and booster seats are effective. For children under the age of 1, car seats reduce the risk of fatal injury by 71% and 54% for children 1 to 4 years of age. And a study published by the American Academy of Pediatrics in 2009 showed that from children 4 to 8 years of age, booster seats reduce the risk of serious injury by 45%. So we have 4 objectives that I want to highlight today, and these objectives really encompass all parts of occupant protection. The first is making sure that we have good seatbelt use. So what we do is we support the Governor's Office of Highway Safety, safety caravans. We also support evidence-based campaigns, like I know you all have participated in, like Buckle Up and the Click It or Ticket. We also, young adult and older driver, we partner together to make sure people of all ages are safe in their vehicles. We also want to make sure that we're maintaining our rates of car seat use, and we support all the work that our partners do. We support the work of Emory's iPrice team. We support the work of the Georgia Injury Prevention Advisory Council. We support the work of GOHS grantees like Atlanta Fire, Byron PD, and Camden County Sheriff's Office. We also support programming towards the initiative Towards Zero Deaths. And a few years ago, for those of you who aren't familiar, in Savannah, Georgia, stakeholders came together to come up with a vision to have 0 deaths on our highways. And they came up with a strategy plan for all different parts of transportation safety: occupant protection, distracted driving, alcohol use, to make sure that private organizations, government agencies, and nonprofits have evidence-based strategies when implementing transportation strategies. We have taken one of these strategies to make sure that people have options to safer alternatives on the roads. We're encouraging the use of Uber, MARTA, and public transport to make sure everybody is safe. And last but not least, we want to increase seatbelt use for rural drivers. As was mentioned earlier, rural drivers are but there's differences between rural and urban drivers, and we've seen that in the latest NHTSA report. And some data that I'd like to highlight is that 49% of rural drivers killed in car crashes were unrestrained, compared to 46% of urban drivers. It's an excellent report. It's on the NHTSA website if you have a chance to review it. And it really goes into the differences between the two for a variety of transportation issues that we see across the country. And we do have an upcoming partnership event between our 3 task teams, and the Georgia Trauma Commission is here today, and they'll be able to answer any additional questions that you may have about this event. They definitely are the experts. It's going to be on Tuesday, July 10th at the Shepherd Center. And for those of you who aren't familiar with the Stop the Bleed campaign, in 2017, the Georgia Trauma Commission got funding to train the public on how to respond to emergencies when there is uncontrolled bleeding. There's a lot of training that paramedics and military receive on how to respond to these situations that the public does not have access to. This training will provide that opportunity for us to learn about how to prevent that bleeding through the use of tourniquet kits, gauze, and trauma pads. It will be an all-day event, and it's a really great opportunity. They are in Georgia schools as well as large public facilities like the airport in Georgia. And we have finalized our meeting schedule for this year. We're going to have 2 in-person meetings, the first being on May 18th. And we encourage all of you to come. We're going to be developing our 2018 SHSP strategies. And the more input, the more people we have, the more encompassing it will be of Georgia, and the more successful of a task team we will be. Our 2 conference calls will be brief updates about the work that we're doing and to make sure that we're really hitting our strategies. And our meeting of September will be a final review of our work for this grant year. This is Tracy and mine's contact information. We support the task team together, and if you have any feedback, questions, suggestions for us, please let us know. We're always open to new ideas, and we're always open to hear what you all are seeing in the field.
I'm Emma Harrington. I'm with Shepherd Center. For those of you who don't know Shepherd Center, it's probably a good thing you've never needed our services, but we do catastrophic brain and spinal cord injury. And we're in Buckhead. And this is a picture of me and my back and a bunch of our patients. And I like to start this not just because Courtney, my old intern, has the greatest face on right there in the front row, but because this is part of what we do. We go out to schools, community events. We bring a whole bunch of our former patients that are young people. We try and bring a mix of brain and spine, but they have to be young because that's best practice. It's peer-to-peer. So these are what I call my Shepherd Center ambassadors. Oh, and I run the young adult task team out of Shepherd Center. Okay, so we've been overrun with a bit of data, but as we know, teens are super vulnerable. One thing that I think is sometimes lost at events such as these is the injuries, the lasting injuries that happen. We talk a lot about fatalities, but at Shepherd Center, we are certainly reminded every day about catastrophic injuries and the multi-million-dollar injuries that people are left with and how lives are changed. So some of the strategies that we work on as a task team, I highlighted quite a few. We are working to map the data to identify the hot spots where we need to target our interventions. Everything we back has to be evidence-based or at least promising practice. We would like to this year increase participation in our task force. We have a small but mighty group, but we are always lacking in enforcement. So please come on down to Shepherd Center. We'd love to have you. We would also like to increase our parental involvement and increase compliance on our GDLs. And that I will touch base with in a few slides. And we do a lot of great social media messaging. Robert is our buddy at Governor's Office of Highway Safety. Last year, one of our PSAs with Molly Welsh was nominated for a Southeastern Emmy nomination. Is that right, Robert?
Yes, it was.
Right? Which was super exciting for us. And also it's wonderful for our patients to be able to give back and make sense of their injury through their own outreach. So it was a win-win. We have quite a few of those PSAs. You can find them at Georgia Heads Up. You can find them on my website. And
Find them on our Facebook page too.
Facebook page too. So we are doing that as well. And that's one of the really fun ones, I think. Okay, this is what I have my little booth out front for, Auto Coach. We got a grant from the Governor's Office of Highway Safety last year. Auto Coach is an innovative app. It's to teach parents how to teach their kids how to drive. So it tracks your 40 hours of time. It gets you through 10 chapters of curriculum. The curriculum was written by our own driving specialists that we have on site at Shepherd Center that get our own patients back out on the road if at all possible. It's a super cool app. It works really well. And we're targeting the parent, not the teen. And the reasons for that is the parent actually has to pass a test on what the GDLs actually are for their state. It's available nationwide, totally free to download, iPhone, Android, the whole 9 yards. And this year, we're coming out with 2.0, and that is going to include cognitive and physical disabilities. So be on the lookout for that. And did I mention free? Okay. We meet every second Tuesday of the month at Shepherd Center. We usually have a call-in, 10:30 to 12. So next Tuesday, we have our next meeting. Looking forward to seeing you all there.